We live in a rapidly urbanizing world. It is estimated that 60% of the urban areas that will exist in 2050 are yet to be built. This global shift is affecting all aspects of life, including the spread of diseases such as malaria. Even though the burden of malaria is still highest among rural communities, most people in malaria-affected countries will soon reside in cities. In Nigeria, which accounts for around 25% of the global burden of malaria, nearly half the population already lives in urban areas. Overall, well-planned urbanization is expected to reduce the transmission of malaria through, for example, expanded access to healthcare. However, rapid and unplanned urbanization will likely contribute to an increase in malaria transmission, particularly among the urban poor. The urban poor often lack access to quality healthcare and suffer most from the impact of becoming ill. The invasion of mosquito species that adapt easily to urban environments, such as Anopheles stephensi, may heighten the risk of malaria in urban areas. Until now, malaria control approaches, including mass distribution of bed nets and indoor residual spraying, have typically focused on rural areas where they have been found to work well. These same approaches might not be as appropriate in urban areas, where malaria transmission is often concentrated in pockets of the population. The new global framework for the response to malaria in urban settings, developed by WHO and UN Habitat, has been designed to provide guidance to city leaders, health programmers, and urban planners, and calls for collaborative partnerships and a multi-sectoral approach. Communities need to be at the center of decision-making, and governments should integrate malaria responses within the broader urban health agenda. Importantly, responses to malaria in urban settings should be integrated with those of other vector-borne diseases. City planners are uniquely positioned to address this challenge through well-planned urbanization. This can help to reduce the transmission of malaria through adequate housing, piped water, better drainage and a cleaner environment, and expanded access to quality healthcare. The framework emphasizes the need for strengthened disease surveillance systems and granular, locally focused data. This will allow existing WHO recommendations, such as on the use of vector control, chemoprevention, and vaccines, to be tailored to local contexts and for malaria responses to be planned and implemented in a more targeted way. As urbanization accelerates, particularly in malaria endemic settings, we need to shift our strategies and address malaria control in a holistic manner. Through working together, we can create healthier, sustainable cities for all and build resilience against the threat of malaria in urban areas.